Hello everybody, and thank you for those of you that have joined us on this session today. We hope you enjoy it. We hope you have a nice and interesting time learning more about the West Midlands Health and Wellbeing Innovation Network and about the things that we look to deliver, and also about some of the things that we are looking for people to join us and work with us and help us. So just a little bit of housekeeping before we start. The session is being recorded. You won't be able to be seen when you're giving any questions, because all the questions need to be issued into the chat bar. Actually, it's a Q&A bar, I think, on this session. So if you look in the Q&A box and put any questions that you'd like to put in on there. You can be anonymous throughout the whole of the session. So please do feel free to ask those questions at the end and enjoy the presentation. Thank you. Next slide. So the first thing I'd like to do is introduce my colleagues who will be presenting today. So we've got David Hardman, who's the Managing Director of Bruntwood SciTech in Birmingham, David Plum, who's the Chief Innovation Officer for the University of Warwick, I'm Wendy Coy, Director of Operations for the Innovation Group here at the University of Warwick, and Lucy Gilbert, who's the Innovation Lead for University Hospitals Coventry and Warwickshire. So you'll be hearing from the others later, but in the meantime, you're stuck with me. So next slide, please. So this slide is just a summary, really, to show you what this is all about, what we're going to be doing with the West Midlands Health and Wellbeing Innovation Network. As you'll be aware, health is a priority, not just in health terms, but also improving the health of the nation has always been part of government and NHS strategy. But it's also that development of the regional and national economy that's important. And the health economy is a vital part of our regeneration through the next months, years. The asset base, as you'll know, across the West Midlands in life sciences, health, tech, creative and digital, and a range of other industry sectors, it's a real crucible of talent. We've got a lot of SME and spin-out development, and we've got a huge life sciences sector and tech sector that can support that regeneration. In order to utilise all of the talents and combine them and channel them into one space, really, we needed something that brought everything together, providing the real solutions to real health sector challenges, enable those changes across the region and across the health sector. So what we envisage is that the West Midlands Health and Wellbeing Innovation Network will provide that joining up, and we'll be able to focus on the solution process and multidisciplinarity of all of those assets across. We'll join all of those together, but we will start with a pilot. But the pilot, although it's based across Birmingham and Coventry in terms of the people who are running it, it is open to everybody across the West Midlands, and that will build on our networks and have added value rather than duplicated value. We're not seeking to deliver the same thing as other people. Next slide, please. So innovation is vital. The environment requires that we do new things, new ways, and have new approaches to doing those, and new people doing them to a degree as well. So health is a particular issue. Our current processes are being challenged. So the way that we had done things needs to change. We've got huge waiting lists as an example of one of the areas of impact from COVID, and we need to find ways of getting through those, and whether that's doing things differently or doing different things or having different methodologies and technologies to help us will be key. Technology obviously has changed, continues to change, was always changing, and the access that we've got to data is changing as well. And although that might be with its own set of challenges, it does actually give us some real AI and indicator data as to what we may or may not do to make things better. I think another impact really of the changes through COVID has been societal change and that shifting of people's social values. So they're looking more to the community, they're looking more to sustainable ways of doing things, and social enterprise, I think, is really increasing through the time that we have been COVID. So just to move on to the next slide. Thank you. So you'll see here the slide that shows some of the people that we've been collaborating with and conversing with and consulting with as we've developed this process. So we've named some of them on here and some of the people that we've spoken to, but clearly these are the external people that we've spoken to. We've spoken to a number of people from within our organisations. We've spoken to people in corporate and consultation and consultancy organisations too. I think, you know, it's fairly clear to see that we need to involve all of the existing assets that we have when we're looking to grow those pipelines and networks across the region. We can't do this by ourselves. We wouldn't want to do it by ourselves. We need to engage and work with all of those organisations. Next slide, please. So we aim to build on our unique position. We've got an NHS acute trust, a world-class university and medical school, a proven and scalable innovation programme and approach using some of the approaches through Bruntwood SciTech. We're ideally placed to find the commercially viable solutions to patient and health-centred challenges, and to look at how we then commercialise those to make sure that they do fill the needs that we need them to fill. Next slide, please. So what sort of challenges will we be putting in place? Well, we again spoke to lots of people. We spoke to colleagues in the NHS, in Public Health England, in the university, and we also took into account some of the current health priorities that we've got. So we've got 3 slides that just show some of the scope of those challenges. It's not an exhaustive list, and it's not necessarily the complete list that we will use when we're devising actual challenges for the workplace. So these particular ones on this slide are the COVID-driven ones. We particularly found that there were some immediate things that needed solving when we were developing the idea for the network, and these were some of the things that could have been the outcome from looking at those challenges. Next slide, please. So again, this slide, a more broadly driven set of challenges, things that were already issues that may become more of an issue as we go into something that is socially distant. And next slide, please. And again, the technology driven kind of challenges that we might want to look at. So are there answers that technology can help us with in the world of health and well-being? Next slide, please. So how will it all fit together? So this slide here just shows us pictorially the sort of bit in the middle, the pink University of Warwick and IBC, that's the Bruntwood Innovation Birmingham campus, joining together in the centre to provide facilities, as in space where people can enjoy the programmes and network and test their products, their services, find mentors, find investors, find places to pilot. We're looking to the healthcare setting initially to come up with some challenges and some ideas, but also to pilot the activities that we do with some challenge owners. Ultimately, we're looking for corporate challenge and funding later on in the process, and we'll be looking that the pilot demonstrates how good we are at providing this programme and getting businesses up and running. We clearly want entrepreneurs and startups and motivated businesses to join our network, and we want them to be providing the solutions to the real challenges that we find. So, next slide, please. So we're going to have a word or two now from fellow collaborators. So we're going to start by talking to Lucy Gilbert, who's the innovation lead at University Hospitals Coventry and Warwickshire. So I shall hand over to her. She will then be followed by David Plum, who's Chief Innovation Officer for the University of Warwick, who will hand over to David Hardman, Managing Director of Bruntwood SciTech in Birmingham, and then back to me. So I will hand you over now to Lucy. Thank you.
Hi there everyone, thank you Wendy. So as you're probably all aware, UHCW is a large acute teaching trust, and we have a dedicated innovation team here in the trust which sits aside and independent from research and development as our own innovation team. So it's a really exciting time here at the trust with a new electronic patient record coming in the near future. And we're also really focusing on becoming a much more digitally enabled trust as well, with trying to reduce the number of people coming into hospital for outpatient appointments, using digital tools to increase productivity, but also really focusing on how we can prevent people from needing to come into hospital. So a real focus on that preventative and community care, working with our other partners as part of the Coventry and Warwickshire integrated care system. So the innovation team here at the Trust, we're housed in the Innovation Hub at UHCW, which is over in the Clinical Sciences building here on site. And this hub is a large open plan space to allow for collaborative work, to facilitate creative thinking, to facilitate innovative activity. So the idea of our innovation space is that all staff can come along, all of our partner organisations can come along, and when you come into the hub you feel like you're stepping away from a hospital environment. So it's really quite a unique space to allow people to discuss challenges, potential solutions, brainstorming, or progress other kind of transformative work. So the innovation team have 5 main work streams, which we're really excited about. Our work's mainly focused on the UHCW Trust across both our sites at Coventry and Rugby, but we've also got a new role starting soon within the team, which will progress innovative activity across all the partner organisations across Coventry and Warwickshire, and work to extend our work over into George Eliot and South Warwickshire and Coventry and Warwickshire Partnership Trust, as well as the CCG and primary care. So our first work stream is really focused on building this innovation community, developing our innovation hub and making it a real hive of activity. We also do a lot of work around adoption of innovation, so adoption of national things, adoption of local innovations from local Coventry and Warwickshire based SMEs, and also innovations coming through from the AHSN network. We also do a lot of work of harnessing ideas from staff, and I think that's a really exciting area of work that we do. So we've got a very well developed innovation pipeline where we can pull in ideas from staff, patients across the trust, and then support them to develop those ideas into a real solution that we can potentially push forward and commercialise. We also do a lot of work on developing staff in innovation and creative thinking to really develop an innovative culture around the trust. And then our final area of work is really around harnessing and refining our challenges. So Wendy's already spoken about some of the challenges that we face as a trust, as all trusts face across the country. And I think that's where I'm really excited about being a part of this network to really support us in defining our challenges and going out and seeking solutions to those. So a lot going on, lots of exciting activity here at UHCW, and I'll hand you over to David.
Yeah, thanks, Lucy. We're equally as excited here at the University of Warwick, and lots of synergies in terms of the things that we're doing in the work streams we're working on. When I think about the sort of ecosystem we have in terms of the Warwick Innovation District, you know, it's a very large ecosystem. Last year we had about 7,000 people participate in one way or another. We run programs where we look to inspire and educate and incubate both individuals and businesses. So we work across the whole sort of spectrum, right up to, you know, businesses selling out for £50 million on our science park. We had one of those the year before last. So it's a really sort of broad range, right the way from students all the way across. We're very keen to help our businesses grow, and investment is a really important part of that. So last year we helped our businesses raise just over £45 million of external investment, of which 3/4 of that was from the private sector, and the rest came from grants from the public. purse. So we're sort of very proud of our ability to partner with organisations and help them get that investment. In terms of this particular initiative, for me, it's really exciting to be collaborating across the region. So seeing Coventry, Birmingham and Warwick coming together, seeing hospitals, commercial organisations and universities coming together. This is very much the first stage. We'd like to throw it open to other parts of the region, other players within the region. So we really want this to be a West Midlands initiative. I think having the hospital, the trust involved is really, really powerful, because the challenges will be real challenges, and we have a real test bed to try the new ideas, to get evidence, to find out what's working and how we develop that. So I think the fact that we are working in partnership so closely with the trust is very exciting. And then also the same with the Combined Authority. I mean, I was looking the other day, 1 in 8 journeys in the Midlands involves health and well-being. So it's not just the case that improving health outcomes is good for our citizens and helps us start new companies and create new jobs, but actually it should reduce journeys as we digitise and provide better healthcare closer to home. And if 1 in 8 journeys at the moment are going to health and well-being, you can imagine if we could reduce that, the impact on congestion and carbon. So for lots and lots of reasons, this is very important to us. We have the commitment of the executive board here at Warwick. I'm very, very excited to get started. So with that, I'll hand over to David.
So thank you, and excitement levels continue here too. Bruntwood SciTech is a joint venture business between Bruntwood, which is a property company, and Legal and General Capital, and we operate what is becoming the largest network of science and technology related buildings for commercial application. Our objective is to promote thriving cities based on the knowledge economies, and particularly within those cities, thriving innovation districts. Today we're operating in Manchester, Liverpool, Leeds, Birmingham, and just outside Cambridge. We're looking to join in with another couple of cities in the incoming year or so. Key to all this is innovation, and our belief that innovation happens best through partnership, and this partnership absolutely is an extension of what we have been doing now for a number of years in Birmingham, but very keen, as David has already said, that this is a West Midlands wide activity. So the pilot is focused on Coventry and ourselves, but we will be looking to expand that more and more as we bring other activities in. The network bit is a network of innovation centres working on this programme. The other aspect of doing what we've been doing over the last number of years is the realisation that the quickest way to get innovation into the marketplace is by making it demand-led. So a piece of technology looking for a problem takes longer to get into the market than the other way around. You have a need, then let's find a solution for it. That is what we launched back in 2016 with a program called Serendip, and we'll talk about the processes of how we've combined that into this program in a second. But it's operated now since 2016. We've supported about 150 businesses, but importantly, within programs that last 4 to 6 months, there have been nearly 50 commercial deals come out of it. And that is about that, moving the idea into the marketplace. In this case, moving that idea into the healthcare sector and getting it to deliver. That is the key objective. That, and of course, then as a result of that, creating knowledge economy jobs, which in this post-COVID world is going to become ever more important, as well as the technology that we do it. So thriving cities, thriving knowledge economies, and engaging the citizens of the city in the positive outcomes from this. So if we move to the next slide, the process that we're looking to launch is effectively based on our Serendip program. But in this slide, as you can see, we've got the route in that the University Hospitals Coventry and Warwickshire have in terms of how they source the opportunities coming out from the clinicians. With this program, what we're looking to do is to take that piece, and indeed hopefully from other NHS trusts across the region, but also link that then to people who are not necessarily working directly in the hospital sector at the moment, maybe in a completely different sector, but actually have a solution that will solve the problem that we identify. So the objective is to identify a set of challenges that define a need for a technological solution. That we then socialize through the various networks that the university has, the hospital has, and we have. We will put together cohorts of innovators, of entrepreneurs, startups, SMEs, and we will work with them, connecting with the hospital to make it relevant from day one, to take things forward in a, if you'd like, a living lab test bed, to actually take those ideas and get proof of concept as quickly as possible and move them forward to testing and hopefully rapidly into commercialization. So it's a collaborative activity. We're looking for people to join our two teams to add value to this, and then working, say, in this pilot with the Coventry and Warwickshire Trust to identify the challenges. Subsequently, those challenges in futures could come from the other hospitals, or indeed from corporates who are coming up with a need that they need to solve. Just to give you an example, the most recent program we've been running has been within HS2, and that has operated right through the COVID period. So it has been a largely virtual activity. Within the first cohort, there were 5 businesses, and within 3 months, they'd raised £2 million towards delivering their ideas into the supply chain for HS2. So if we get the demand right, and we get the we get the need right, identified, and the demand, then this is a rapid way of getting new products and services into the marketplace. So I'm really excited to actually see this operating and providing that opportunity for innovators and entrepreneurs through this partnership. And with that, Wendy, over to you.
Thanks very much, David, and thank you to all three of you for giving some more information. So, what do we need to deliver this? Next slide, please. We've created a resourcing model to launch this first stage, and the posts that you can see up on the slide currently are the ones that we're looking to fill. We're concentrating particularly in this one on the innovation manager role, but a brief summary exists up there of the other ones as well. In essence, we're looking for a team of people who between them provide the expertise, the ability to do, the ability to network, the ability to strategically plan and develop, but also to help and to coach and to mentor. So in addition to the paid roles, if you like, that we have those top 3, there's also opportunities for people to join us and work with us as volunteers, mentors, coaches, experts. And we've got a database that we are setting up for people to join us on that. So I think if we concentrate for this session on the innovation manager role, it's a really, really key role in the delivery of the network objectives. We're not looking for the earth, but we are looking for somebody who can join us in our happy team. You've heard how enthusiastic we are about this project. We need somebody who's equally as enthusiastic about it. Somebody who's passionate about health, about improving things for the nation, for the region. Somebody who has experience of capability building in business, wherever that has come from. But somebody who is a doer, a networker, somebody who's able to help, to source information, to source people, to source programs, to source space, to manage and administer the program as well. We obviously need to keep a track on what we're doing. We do have KPIs. We are funded in the first place by the West Midlands Combined Authority, for which we are hugely grateful and appreciative, and as part of their innovation programme of activity. So we are held to account. We do need to make sure that we're doing the right thing in the right space. So we do want somebody who's going to be able to help us to get there. Ultimately, we're looking for things that are commercially viable at the end of this, and that is about getting things into health sector organisations through their procurement processes. So somebody who's able to negotiate and work their way through some of those programmes will be absolutely useful. There is a need for us to also develop a funding stream for the next phase of this. So we will need to be going to corporate organisations or other health organisations to fund challenges and to fund solutions to those problems that they face. So there will be an emphasis on that. So the roles that you'll be working with, you get joyfully to work with us, who you've seen today on the presentation. And others, obviously. So we're looking to recruit an entrepreneur in residence. That'll be somebody who will spend some time, it's not a full-time post, but some time, because they have already done the building of a business in some form or other. They will be able to share their knowledge and their expertise, and they will be able to do some delivery of programmes as well. And an exec chair who will be doing a lot of the strategic relationship building, but also being passionate about what we do and linking us to the types of corporate relationships that we need to be able to progress the network. So as you can see, we're all very excited about it. We can't wait to get the people in place to get more things going. We are developing challenges even as we speak, developing the process to get this up and running. And we really do look forward to having some of you certainly put applications in to join us. Next slide, please. So if you are interested in getting in touch with us, these are some links that you can click on. We will be putting this presentation up onto our web pages, so you'll be able to find it and click on it. But I think we're going to put those links into the Q&A bar anyway. So that would be good. If you're watching this and thinking, you know, I would like to join you, but maybe I don't want to join you on a full-time basis, maybe I want to join you as a volunteer or a mentor, then please do log on for that. If you log on to the Warwick Innovation District, you can also receive our newsletters and things as we build them out. So please do sign up to that. Next slide. So this is just an outline of the timeline, a rough idea of what we're doing and what we hope to get to. There was a load more activity before we got to this point, as you can imagine, devising and developing the network, proposal, going out, getting funding from the West Midlands Combined Authority, consulting, etc., etc. But we're now in recruitment to post stage, and we're looking to recruit to our first challenges sort of later, end May and through June, July. And we'll be running the programme as soon as we possibly can. So we're really looking forward to getting people on board. So what I'd like to do now, next slide please, is just to go to David Plum. I don't know if we've had any questions in the question bar, but if you have questions, now's your time to put them in. And David will curate our questions for us and ask whichever panel member he thinks is appropriate. So back to David.
Thanks, Wendy. We don't have any questions at the moment. Teo has just put in the application process and the contact details, but we don't have any questions just yet.
Okay, well,
Yeah, so nothing's come in so far, Wendy. Oh, hang on, we might have a new one here. Here we go. There's a couple starting to come in now. So the first one is, how long does the current funding last for? And I think that probably is for you, Wendy.
okay, thank you, David. Yeah, so we're currently funded for a year. But we are recruiting to permanent posts because we have the evidence that this kind of funding stream and funding model is successful and has been successful in other areas that David Hardman spoke about earlier. So we are quite confident, and the organisation, the university, is quite confident that we will be able to go out and get that funding to continue it.
Thanks, Wendy, and I would echo those comments. The next question is, I think, probably again to you, Wendy, in terms of, is it possible to do this with flexible working?
We're absolutely open to talking to anybody about working patterns. It'll need to meet the needs of the business and the activities that we're doing, but as an organisation, we operate flexible working, so yes, we can certainly talk about that.
And then the final one I have so far is not a question, but just to say great presentation. So perhaps that's why you don't have many questions, Wendy, because it's so well explained. Got such a great presentation, but those are all so far.
Okay, so thank you all very much. Thank you to those of you that have joined us and watched the presentation. Thank you to my fellow panelists for delivering so wonderfully, and thank you to the tech team behind the scenes who have made it all happen and clicked from the right slide to the right person. So thank you very much for doing that. I do look forward. So there is another question actually that's just come in.
Yeah, one's just, yeah.
So, yeah, how will this interrelate to the AHSN, who offer an incubation innovation service to the region? So how will this interrelate to the AHSN, who offer an incubation and innovation service to the region? So we are in contact with the AHSN. We've had good conversations with them, and they absolutely see how our offer is working with theirs rather than duplicating it. So we're very much about the demand-led and the commercialisation, and we will absolutely work with them to deliver more innovation into the space rather than the same. So I think that's all of the questions, and so I will just check there's one new. Hi, and thanks to everybody for what they've shared. That's great. So thank you to all of you, and I do look forward to receiving applications from anybody who wishes to put them in. The closing date I should have written down, but I think is the 25th of April. But it will be on that link, so if you're interested, do click on the link and put the application through the normal University of Warwick process. Thanks all very much, and we'll sign off now. Thank you.